Hey everyone, this is Bella Mehta reporting for Room Now. I just came back from the EULAR conference, and there were a few very interesting abstracts and presentations that I would want to talk about. A lot of them, I think, that caught my attention were related to this general theme of AI or artificial intelligence, telemedicine, digital health, and overall measuring health with these new tools. This particular session that I attended was talking about transforming healthcare, how to navigate the new technology. And something that caught my eye is Lupus GPT. There was a lot of talk and awards that went out at EULAR for this particular tool. I think it's very interesting because whenever you have a new patient come in and you diagnose them with lupus, the last thing before they leave the room, you tell them, hey, please don't Google, because there's some doom things out there on Google or some of these social media sites. Some of it is true, but a lot of it may not be. And I always caution my patients when they go out saying, make sure that you consume the right information, especially with this new diagnosis that you have. So, you know that nowadays either patients Google or Chat GPT things, because Chat GPT is this large language model or generative AI model which communicates with you and you can ask questions. And I have recently seen a lot of patients using it, either to find care, find the right diagnosis, find the right diet, or whatnot. Um, so, um, but the problem with all of these tools is that it is unregulated in a way that it consumes information from all over the internet. So whatever goes in, so garbage in goes garbage out, the way some of my professors used to teach me. So what these guys did is created this tool, which is only vetted information. Initially, they took ChatGPT and made a small sort of out curve in it, um, with only information which was vetted from lupus resources. They had lupus 100, that is already a data set of questions or usual questions that patients would ask. And they went in and created this interactive tool, Lupus GPT. What was interesting is that initially when they built it, they obviously needed engineers and whatnot, but now this is sort of driven by patient care organizations who can go in themselves and tweak these with very little computational skills, which makes this a live tool that can be tweaked, which is very important because a lot of things in this dynamic world are changing, and to be able to have that ability to change things on a platform like this makes it crucial. Second thing that they talked about was cost. The cost of maintaining this, I thought, would be thousands of dollars, but seems like they are, at least once it's created, perpetuating it with very minimal cost, like $100 or so. Overall, I think this is a good tool that I would want to recommend patients, especially with lupus, going out there and seeking at least the right information, which will not, scare them too much. At the same time, give them enough information to deal with a new diagnosis, or even patients who've had this diagnosis for a while, at least a safe place to find reliable information. And also, it's not just Googling it, it's an interactive tool like all large language models such as Chat GPT, etc. What I also saw that this is a particular theme that is being translated into many other diseases. For example, poster 08008 was also sort of similarly putting in this concept of creating these generative AI models which are customized for particular rheumatic diseases. In this case, they did it for rare diseases like vasculitis in Ireland and deployed it in on this website, which was usually used by something like the Vasculitis Foundation there. So overall, I think that these tools will be seen more and more as we go into more digital future as well, as where the world is going, and we'll see that in rheumatology too. I would definitely recommend patients that I'm seeing to go out and try this tool, because it's in several languages. You know, sometimes things are lost in translation, but these tools are equipped to deal with that. And it's free, it's easy to use. So I think this was one of the highlights for me, to give a tool for my patients to use. And with that, follow me for more updates on Twitter at Bella_Mehta, and we'll be reporting from Room Now from EULAR in Barcelona. Thank you.